Hi everyone, my name is Shoaib Rezai. I graduated PA school not long ago in December of 2020. Today I wanted to talk to you guys and answer some questions about myself and also give you some insight about what being a PA might look like for you. Just a little bit about myself. I moved to the US 16 years ago from Azerbaijan. I speak multiple languages such as Farsi, Azeri, Hindi, and moderate Spanish. I completed my bachelor's degree in biology at the University of Houston. Then I started working at MD Anderson Cancer Center in phase 1 clinical trials, where I completed money data for a lot of those pharmaceutical companies that you know, Pfizer, AstraZeneca. I was introduced to PAs while working as a scribe, and I was a pre-med student, and I had the opportunity to see what the PAs do and what the doctors do and what the NPs do in the ER, which was very gratifying for me. I currently work in a pediatrics clinic here in Humble, Texas, where I see about an average of 30 patients a day, mostly Spanish speaking. So I'm 90% of the time speaking in Spanish to them. And most of the cases that I see are for sick visits, well exams, vaccinations, and sports physicals, and some adult case COVID patients. I also voluntarily work on Saturdays in 2 other clinics, one in downtown Houston and one other one in Houston area. I wanted to talk to you guys about an asthma exacerbation case that I saw. A 6-year-old male who presents to the clinic with asthma exacerbation with the typical symptoms from the book: coughing, wheezing, chest tightness, and shortness of breath. I take a look at the vitals. His respiratory rate was more than 30, and his oxygen saturation level was around 88%. I immediately talked to my MA. I have 2 MAs that in my job that works with me. I talked to my MA. I started the patient on some steroids orally, and also started him on an albuterol treatment, nebulizer albuterol treatment, and we evaluated the patient in about 15 minutes. At this time, his wheezing had decreased, was still wheezing a little bit, but was not gasping for air. He was not coughing anymore, and his oxygen saturation level was going up. It went to 90. So I was happy that it's working, the treatment, so I started him on a second treatment of a nebulizer. And after 15 to 20 minutes, I reevaluated him, and he was no longer wheezing, not having any shortness of breath. His oxygen level it was more than 94% at this time. And I sent him, I started him with some medication and sent him home. At this time, I did educate mother about all the signs and symptoms to watch for, and if he starts wheezing again, what to do, when to go to the ER. And I had a follow-up for him to be seen again in 1 day and see how he's doing. And on the second day when I saw him back, everything was normal. His asthma was controlled well. I had started him on Flovent, twice a day, albuterol, and a short-term steroid treatment for about 3 days, with a nebulizer treatment every 4 hours for the next 3 days. And that was the case. With my salary, the first thing I did when I got that paycheck was I booked my family a vacation home, which had a big pool and everybody gathered there, and we barbecued and just celebrated, had a good time. And the first other thing I purchased was I bought a house with my PA money, which I currently live in. We built it from scratch. Also, I did a little bit of investment. I purchased a 40-acre land with my family. For me, most gratifying has been the smiles on the parents and patients. When I do a follow-up with them, that I see that everything, when they come for a sick visit and everything has resolved, they're smiling, they're very happy with the results. That is the most gratifying thing. And that's another reason why I did pediatrics. I started working as a in a pediatrics clinic, because during my rotations, when I did have my rotation in the Valley, I saw that when we were treating these patients, like pediatric patients, I was seeing the results of the medications, that it was working. So that's why I chose to go to this route, because kids are usually don't have a lot of illnesses, and they're mostly acute illnesses. If you like to see the results of your medicine working, then pediatrics is an option for you. The one advice I would give somebody who is in a didactic year: learn everything you can in the classroom, outside the classroom. You never know which information you will need, and all this information will build like a backbone for you. So if you have good information, when you start practicing, everything will make sense, everything will click. And for those of you who are in a clinical rotation right now, be more proactive, okay? Take every opportunity you're given. Make things happen to you. Don't wait for them to happen to you. That's what I mean by being more proactive, okay? Show initiative in every rotation you go to. Don't wait for them to ask you to, hey, do you want to do this suturing? You should volunteer. And that's it for today. Thank you for your time.